This one goes back to the blood work. She needs more clarification on why blood work is not needed for hormone replacement therapy.
So blood work doesn't tell you, blood work doesn't do a good job of really telling you where your hormones are all the time. It gives you a snapshot of what your hormone level is the moment they did the blood work. As I talked about earlier, one of the big problems with the menopause transition is those hormones fluctuate greatly up and down. And that's really what causes a lot of the symptoms, is this huge fluctuation. So for instance, hot flashes is really thought to be from these sort of peaks and troughs, these giant fluctuations in estrogen levels. And those actually go away once you go through menopause completely. So eventually your ovaries completely shut down. They stop making any of these hormones. And then you don't get fluctuations. You just have basically none of this. You have a little bit from other tissue, but you have very little bit circulating around. And the hot flashes usually go away at that point. The others sometimes get worse, but the hot flashes themselves go away because those are due to these big fluctuations. So if you think about drawing blood, you're basically taking a snapshot at time. And so you could be at the peak of one of these fluctuations, or you could be at the bottom of one of these fluctuations, or you could be in the middle of these fluctuations. And so that number doesn't really tell you sort of what's going on all the time. It tells you what's going on at that moment in time. And that's not necessarily going to tell you anything about what your symptoms are or how much hormone you need, or if you need hormone at all. I'll give you an example. I'm on blood pressure medication. So the symptom of needing blood pressure medication is my blood pressure was too high. So my doctor didn't order blood tests. That's not completely true. There's blood tests that you order with high blood pressure to make sure that there isn't something else causing that high blood pressure, but you don't order blood tests to decide what dose of medicine you use. So he started me on medicine, and I followed my blood pressure, and it wasn't enough, and he increased that, and it still wasn't enough, and he added another medicine, and eventually we got my blood pressure under control. But we didn't do it with blood work. We did it by watching my symptoms. My symptom in this case was high blood pressure. And so in the same way, that's how we treat menopause. You tell me your symptoms. Your symptoms guide me to tell what kind of medicine to start you on. We put you on that medicine. We monitor your symptoms. Your symptoms get better, and we know, okay, we got it right. Or your symptoms don't get better. It's like, okay, we need to push this a little farther. Or occasionally we need to start a different medicine, or kind of change the approach that we're doing. But blood work doesn't really enter into it. There's a lot of things we do that way in medicine. Honestly, sometimes you don't think about it. But for me, when I had to start blood pressure medicine, it's like, okay, well, this is kind of the same thing. And so that's the way we do hormone replacement therapy. It's the correct way to do it. It doesn't mean there aren't people out there ordering blood tests, because there are. And honestly, some of it is because patients want it. So it's easier to do what a patient wants than to try to explain why it's not necessary. And so I know, in a busy office practice, for instance, it's easier to just hand them a blood slip than to spend 20 minutes trying to explain why they don't need the blood work if somebody really insists they want blood work. And so people just say, okay, fine. And they write you for blood work. Doesn't mean it's the right thing to do. It doesn't mean it's going to be helpful. But it's the way a doctor gets through their day, unfortunately. So that's a little kind of peek behind the curtain of what goes on. It's not the ideal way to do medicine, but unfortunately it's sort of a practical way. I don't have that same constraint really, because it's a different situation with Winona, the way we interact. So, I don't order blood tests because they're not useful. It's a waste of your money and it's a waste of your time. On the other hand, I've had patients that have gotten blood tests. I'm happy to look it over with them, and explain, what I'm seeing, but I don't put a lot of faith in what the blood tests are showing.